Welcome back to the Manifesting Health series. I'm Curry Bordelon, your host for this discussion. The Manifesting Health series, for those of you who don't know, it provides engaging interviews with our experts in men's health. So today we're excited to have Dr. Susan Quallich join us for this episode of Sexual Health and Wellness Among Men. Dr. Quallich is a nurse practitioner for the Department of Urology at the University of Michigan Division of Reproductive Health, with a focus on men's health and sexual well-being. Dr. Quallich was the first MP named to the Society for Male Reproduction in Urology and the Society for the Study of Male Reproduction, and is the editor-in-chief for the Urologic Nursing. Welcome, and so glad you're with us, Dr. Quallich.
Oh, I couldn't be happier to be here. It's so exciting to have an opportunity to talk about all of the men's health things that I've been involved in.
Excellent. Thank you so much. So as we get started, tell us a little bit about yourself and what got you in the space of men's sexual health and wellness.
To some extent, you could say it was an accident. When I was in my NP training, I did a lot of clinical time at the Cleveland VA and really loved the veteran patients. And my first jobs out of school were at the Detroit VA and the Ann Arbor VA, and just really grew to be very fond of the veteran patients and their needs. And particularly at the Ann Arbor VA, I transitioned into urology from primary care and was assigned the erectile dysfunction clinic. And so really got into it sort of by accident and just learned to love it because the men there were so grateful to have the opportunity to talk about what their experiences were and to really have me work with them to find something that was going to be that was going to help them achieve their intimacy goals. So it became just a very rewarding path for me. I really enjoyed helping these men with their issues. And then I was recruited over to University of Michigan to really focus exclusively on andrology or men's sexual and reproductive health. So just have taken that and have run with it over the course of my career, and it's been still my favorite patients to take care of.
Excellent. Thank you for sharing. I really appreciate that background look of kind of how someone can come from an MP position into something very passionate to help others and so many different people in different populations for that matter. So let's talk a little bit about where we are in the science. Let's talk about where we are with sexual health and wellness as a science and what are some of the gaps that we're finding?
I think some of the gaps are really trying to find effective ways to engage men who don't have sexual function issues as a result of something, prostate cancer, colon cancer, something that's interrupted something in their pelvis that's made erections difficult. So for folks who are just having sort of routine erectile issues or intimacy issues as a result of things like high blood pressure, diabetes, I think that conversation, getting men to acknowledge that that's an important piece of what's going on with those other conditions sometimes is the biggest challenge. We have options that are appropriate for almost everyone, but you have to be here for us to offer them to you. And so sometimes just getting men engaged in that conversation or present in clinic is really the biggest challenge.
So I'm glad you mentioned and you talked about just having men at least getting them into the clinic is the step one in many cases, or at least to have the conversation. Some of our other episodes we've talked about the disparities in men's care outcomes and their outcomes long term compared to our female counterparts, and how men typically live 7 years shorter than a female counterpart, and in many cases it's because of the lack of health-seeking behaviors and that also can play into this as well as even early identification of some of these complications and how they can be treated or they have different therapies for treatment to help them. So, as we're constantly challenged with getting that word out, if you will, that there are ways that we can help you, but you have to come in. How do you convince that reluctant male? They're already reluctant with blood pressure and obesity or heart disease or what have you, but now something as intimate as sexual reproductive health, how do you get that population to have that conversation?
Well, I'd like to turn that question a little like about 90 degrees. And one of the things that I've tried to emphasize throughout my career is that it's not high blood pressure that drives men into the clinic. It's a failure of them to be able to pursue whatever intimacy in many instances. And so when men come into a clinic saying they have issues with erections or ejaculation or whatever that may be, that's your opportunity as a provider to be an ambassador for the whole rest of healthcare. They're in there because they have identified something that is personally important to them, and it's our job as providers to take that entry that they've given us and then to kind of move that into all those other places for preventive health, but to be that ambassador. And sometimes, particularly for those of us working in urology or in the sexual health arena, we are the big ambassadors to the rest of healthcare because that's what gets folks into the system. So I try to emphasize that whenever I do conversations with all different groups of all different levels, is that you need to be that ambassador and to not shut down those conversations about sexual function, in lieu of focusing on diabetes or obesity or what have you, because that sexual function complaint is what that particular patient has prioritized as his reason for engaging or re-engaging with healthcare. So it's important to acknowledge that within the scope of a visit.
How often do other comorbidities play into the sexual health and wellness of men? How often do you often find that these are the other most common items or comorbidities that will impact the sexual health and wellness?
Well, we have a saying that nothing exists in a vacuum. Sexual health doesn't exist in a vacuum, and you may be identifying that the fact that your erection isn't what you are hoping it would be as the primary issue, but we're thinking about what has led to that. Is it a lot of anxiety? Is it legitimately diabetes? Is it high cholesterol? Is it high blood pressure? Is it the history of smoking 20 packs a day? So there, it doesn't exist by itself. That's just the opening that they're giving us to try and figure out all what else is going on. All of the things that we think of as the most common healthcare issues, diabetes, high blood pressure, obesity, high cholesterol, impact sexual function. There's a direct relationship between all of those things and sexual function. Then there's then the sort of the side aside to that, or different side to that rather, is just the kind of the intimacy issues and the stress that creates. So then that's a whole nother aspect of a conversation with an individual patient about how that's affecting their ability to pursue relationships. So there's always quite a bit to unpack when those issues are put forward in the clinic.
How often do you find that people are trying to, I don't want to say just self-medicate, but they identify their own treatment to avoid talking about it? They find their own ways of trying to treat themselves in those sexual dysfunctions and or sexual issues. How often do you find those patients are coming to you once they've already tried these very non-traditional or self sort of treatment type modalities?
Well, once they realize that those aren't working as well as they had hoped, or that they're having some kind of odd side effects from the gas station virility pills. And equally common is that men who have sought care over the online platforms. And the thing that I always find curious about that is that they will go through that evaluation, get a prescription and not take it, and then come to see me because they will say, I got this medication, but I'm nervous about taking it. I don't really feel I got the education that I needed. And then we kind of reevaluate that whole scenario. So, I understand. I understand. No one wants to admit to flaws, and our goal is to be as welcoming and non-judgmental in that context as possible. I've heard a lot of, you can imagine, over the course of my career, I heard a lot of real interesting home remedies, and I would like to say I'm not surprised, but sometimes I still am surprised how creative folks can get, and I think that's just a testimony to how much people want to preserve that and want to preserve that aspect of their life and their humanity.
I'm very glad you mentioned pharmacology and pharmacoactive drugs in the sense that whether it be like you said the gas station version or things you can find online that answer series of questions, and they have very compelling
Right.
ads to talk about, hey, you can get this for only 80 cents a pill or $2, $3 a pill versus, so forth. So it makes it very compelling to hook people in, if you will. So how are we coming along with the pharmacokinetics away from the way they receive these meds? How much improvement have we seen in medication regimens and medication design that can help people with their sexual health and wellness?
So, just in terms of the medications that we typically think of for boosting erectile function, where it's pretty stable. It's pretty stagnant at this point. We really haven't seen anything new coming across in many years. Some of the compounded formulations have become interesting. There are some topical products, topical sildenafil topical alprostadil that's supposed to that some folks find very helpful. Some of the newer offerings out there are interesting. Like there was a company that offered a combination tadalafil, sildenafil, or a combination for C- Cialis and Viagra. I can't get it out. A combination pill, which was interesting, and now kind of the Princeton 4 guidelines have caught up with that perspective on combining the two different medications like that. So I think we're getting a little bit more creative with the medications that we have, but not anything really new. Um, and of course, the old school, the injectable, the penile injectable medications still are a mainstay of what we can offer men for treatment, and it does work. They continue to work well and to be quite safe for people who are interested in that route.
So we can't have a conversation like this without talking about some of the latest trends and some of the fads when it comes to testosterone replacement therapy. So
Oh,
years in the past, there was a big wave and uptick of that, and then they had all this benign, prosthetic hypertrophy diagnoses, and they backed off of, as it being as acceptable. And then now we've seen a big wave of that down to the point that there's clinics out there just designed for that. How much does that play into the treatment plans, and or are we in a space where that actually may not be helping the cause for sexual health and wellness?
so you can argue it both ways, honestly. You can argue it from the positive perspective, thinking that it offers men an avenue to really have agency and pursue these treatments on their own. Um, the flip side to that is, nothing in life is free, and sometimes these clinics are over enthusiastic with their treatment regimens to the point where it can cause some of the potentially bad side effects that we see with testosterone. Testosterone has a place. There's no question. I have treated, probably tens of thousands of testosterone patients over the course of my career, and it has a place when you have that person who truly needs a testosterone therapy, and you make them better and you see them become this new energetic person. It's extraordinary. It really does have a place. um, what I find interesting about where we have come over the last 5 years with testosterone therapy is I have been working on some research with some folks in Denmark. And in Denmark, hypogonadism or conversations about low testosterone are just not a thing. It's just not something that they routinely work into their differentials. There's no direct to consumer advertising, because the cultural perspective on it is so very different. So to look at this in kind of that larger arena of men's health, there is a uniquely American perspective to some of this, and that other countries are not nearly as focused on testosterone levels as we seem to be right now. So makes it interesting. There are some folks who unquestionably need it, and there are some corners that are just encouraged to keep using more. Um, more is not always better, no more is not always safer.
No, that gets us in
And
trouble quite a bit.
yeah, so that's they're tough conversations sometimes, and you and I both know that there are other conditions that have a tremendous amount of overlap with low, like legitimate low testosterone symptoms.
Right.
But it's hard sometimes to breach that conversation and say, well, your testosterone is totally normal, but your symptoms remain consistent with depression, anxiety, stress.
Right.
Those are a little bit more challenging sometimes to introduce as explanations.
Yeah, it's so true. And there's so many times one thing leads to another. And like you like talked about at the very beginning,
Yeah,
how everything's interconnected. And that's, we open up that box as soon as we start talking about some of these elements and start testing, and we realize it may not be testosterone, it could be
right,
depression, anxiety. So there's so many different things that interplay. But like you said earlier, this really is about getting someone into the clinic or in the office or on the phone or on the telehealth visit to begin
right.
the conversation in many cases. So I really appreciate your time, Dr. Quallich, together with us and talking about this. As we wrap up in our last few seconds together, what big takeaway do you have for our listeners?
I would like to say from a provider standpoint, be open to hearing these stories from men. And from a patient standpoint, I would say that if you are not comfortable sharing your story with a particular provider, find someone that you think may be more open, or that you have heard from your friends who might be more open. We're out there. I want to hear your story, and I am here to help you achieve your goals. So there is someone who is willing to hear your story and to help you achieve that men's sexual health and wellness.
Excellent. Thank you so much for sharing your expertise today with us, Dr. Quallich. I really appreciate your time, and thank you all for listening, and we look forward to seeing you next time.